Hi everyone. So today we'll be talking about methamphetamine addiction. As we all know, or hopefully after this presentation, you will be able to know like how addictive this drug can be to an individual. So just to give you like a little background of methamphetamine. So meth is also commonly referred to as crystal methamphetamine. Meth is a man-made drug which gives easy access to individuals. This drug can be easily made by paint thinner, chemicals such as battery acid, and a refrigerant, which is also known as a gas. When these chemicals are broken down in the body after either you could smoke it or inject it into the vein, it can cause intense damage to an individual's brain, skin, organs, and their immune system as well. So, just as like a anatomy little overview of the parts in the body that it can affect. So, meth causes damage to the central nervous system. Methamphetamine causes quick addiction because of the euphoria it creates by the release of dopamine. This causes the brain to overstimulate, which leads the nerve cells to become impaired because of the abnormal patterns that are being fired in the brain due to the drug stimulation that it causes. The organs that are typically affected during methamphetamine addiction are the brain, and when it affects the brain, it increases the risk of stroke, heart problems, etc. The respiratory system, so like the lungs, and this causes shortness of breath. And then the heart, it increases your heart rate, increases your chance of heart attack, as I just mentioned. The kidney, so it could cause chronic renal disease and also renal failure if prolonged enough and an individual doesn't seek treatment. As well, over the lungs, it also can cause pneumothorax. So this could be like a blood clot. So if a blood clot happens, it'll travel up to the heart and then the lungs as well. Muscles, so increased twitching. I don't know if you've seen for instance, like if you happen to watch intervention, like sometimes you see these individuals that are addicted to meth, they'll kind of have like muscle kind of like spasms, which causes the twitching. Liver, so it can cause hepatotoxicity, and the oral cavity, which it causes dental abnormalities. It causes I don't know if you've seen like drug addicts where their teeth are kind of like just yellow, they're not well taken care of, and they kind of have like a tooth decay as well. So that's a little overview. Next, for the physiology portion, excuse me. Addiction alters the way the brain works physiologically. Due to the lack of being able to process information from the damage that it has been caused, meth releases a surplus of dopamine in the brain, which sends out a positive reinforcement energy to the individual. So this is also could be seen as a positive feedback loop. Because of this, individuals tend to crave more of that drug, so they don't feel the come down of the drug. So if they're constantly getting high because of the increased amount of dopamine that's being released in the brain, they kind of just crave that sensation. So it's also kind of like, if you think about it, like a coffee addict. Like if we don't, for example, like me, if I don't have like coffee, like I'll get really bad headaches. Sometimes like my mood will change. So this is the same thing with drug addicts. So if they aren't constantly getting that dopamine that's being released in the brain, they're gonna be like, hey, like what's going on? Why am I feeling this way? Like their mood will be decreased, like depression and anxiety. But then when they, get that sense of high from the meth, all their problems are out the window. So for meth addicts, because they are constantly using meth, they'll end up disrupting the natural flow of dopamine in the brain, which will then increase their addiction to the drug. So like I just said, like they're going to keep wanting it because they don't want to feel that come down from not having it. Okay, and then for pathophysiology, long-term damage can happen due to the constant firing of the neurotransmitters happening in the brain for a long period of time. This can cause meth psychosis. This causes an individual to be in a constant state of hallucinations and paranormal. So brain damage is another sign of an overuse of meth. Parkinson's can also show an individual due to the firing of the neurotransmitters. So it's like an increase of constant shaking because their nerves, the cells in the nerves have been damaged, so they can't process fully since it is causing damage to the CNS. Increased risk of heart attack or potential strokes can be present in a recovering or active addict. So like on the screen I have like brain damage, impaired vision, impaired motor skills, inability to learn new skills, and depression from the lack of the natural dopamine being presented. So for diagnosis and treatment, any individual, there's a lot of resource groups out there that they could seek help. They could get sent to like a retreat area where they kind of do like a detox under a professional medical supervision, where they kind of just cleanse their body with the help of medications, of course, and they kind of just like wean them off of the drug. Because if you just do cold turkey, that can also cause like heart attacks because your body isn't used to regulating on without the meth, without the drug. So they kind of give you a detox with medications to help that. And there's so much treatment out there, but I feel like, especially like it's up to the individual itself. Like if they want help, they'll go and get help. If they have that, backbone of support, it's also easier. But a lot of times it is proven that, like an individual will go in to seek help, but then, like they're so used to being high, they're so used to the drug, they're so used to that dopamine being released in their brain. Like without the drug, they don't have that. So they're like, what's going on basically? So they kind of pull back and leave the retreat area. But treatment is out there a lot for individuals. And then the demographics, according to Longleaf Hospital in 2025, they stated that it's an estimated that 1.2 million Americans have abused meth at least once in the previous of 12 months, meaning about 0.4% of the US population has abused meth in the past year. So I feel like this is really high, especially because it's a man-made drug. It's very open and ready for individuals to go and get their hands on it, unfortunately. So yeah, that is it. So hopefully after this presentation you have learned a little bit more about the meth addiction, how it causes abnormalities in our body, as well as don't do drugs because your body can, get addicted really fast and it's not a good path to go down. But thank you for listening to my presentation about meth addiction.